all I want you to do for deltoid is go ahead and put your arm out, and I'm going to do both. Put both into abduction. Because now I can actually see, if I push down, if he's got good strength on both sides. If he's got something going on with C5 on the left side, that arm will drop when I try to push down. The other one will stay up. Got it? Because that's involving the deltoid muscle itself. That's the motor part of it. We did the biceps reflex already. Everybody knows how to do that, yes? We did that last time? Biceps reflex. Put your thumb on the bicep. Hit your thumb. Okay. And then lateral upper arm, just tell me that's where the sensation is. If we go to C6, wrist extensors, and we're going to have the brachialis reflex. So if we have wrist extensors, have them go into wrist extension. Don't let me pull you out. Okay? Again, that's the motor level, that's the strength for C6, and that level right there. Wrist extension, we have a brachialis reflex. So this is what we're going to do. Same position, but remember with biceps we had him with the palm up. Now we're going to have the thumb up. All right? So thumb is up, same position. You can rest it right there. Now we're going to find where the brachialis is. We're going to go towards the lower end of that. So depending on the person, it's probably about 4 inches from the crease of the elbow. We're going to go down here, okay? And we're just going to hit there. And if it works, you see the muscle jump, or you may see the thumb twitch just a little bit. All right? That's a reflex we have for that. Sensation is radial forearm, thumb, and index finger. So remember, when we are looking at positioning, we always put them in anatomical position, right? So when I said C5 was lateral forearm, we're over here. If you want to say, or lateral upper arm is here, lateral forearm is here, that's fine. You can say lateral forearm or radial forearm, thumb, and index finger. So that's what your sensation is on this side. So you have to tell me that that's what you're looking for. Okay, but just remember, when we do this, we assume anatomical position. All right? C7, wrist flexors and finger extensors. We've got two things. Wrist flexors and finger extensors, correct? So, wrist flexors, hands are down. Don't let me pull you out. Finger extensors, okay? Now with finger extensors, this is what I want you to do. Grab the wrist or grab the hand and say, don't let me push you out. Because if I just do this, put them both up, what am I really resisting? Basically, I'm resisting elbow flexion, right? If I push from here. So, we are going to isolate the finger extensors. You're going to push down here. Let me see the other one. You're going to push down here. That is isolating your finger extensors. Okay? Wrist flexors you can do at the same time. Finger extensors, one hand at a time. Triceps reflex. Okay? Put in this position right here. Have them relax as much as they can. We're going to find about where the tricep inserts, and we're going to try to get a good, and we can't. Okay, it all depends. I can't get a good one, so we'll just let it go. Some people you might be able to get a good one. When we're done, we'll let you practice a little bit and try all three of those reflexes. And C7 is the middle finger. Do not have them say, point that middle finger up. We're just going to touch middle finger and say that is sensation. Okay? That's all we're going to do. Any questions so far? C8, we've got your finger flexors. So what you can do here is actually say, go ahead and put your hands on top of mine. So flex your fingers. So they're curling your fingers around your fingers and say, hold that there. Don't let me pull you out. And then just use your wrist. Don't pull them towards you. Use your wrist to try to pull the fingers out. That's your finger flexors. And there's no reflex on that one. So our sensation is the ring finger and the little finger. Okay, right there. T1, finger abduction. Right? So go ahead and have them do finger abduction. What do we do to resist that? What do you do to resist finger abduction? Just push them in like this, right? So, finger abduction. Go ahead. All I'm going to do is, nope, keep them out. Squeeze. Good. That's all we're doing for finger abduction. There's no reflex on that one. And then we go to the medial upper arm. Okay? Any questions? Babinski. We know Babinski, yes? From last year. Do you remember? Okay. Go ahead and have a seat up there for me. You don't have to take your shoe off, but remember this? You would take the bottom of the foot and run it up the bottom of the foot. Yes? Okay. So, the reason I want to do Babinski is because we're talking spinal cord and brain. Yes? What should their toes do when you run your finger up the bottom or run that up the bottom? They should curl, right? If they extend, that's some serious trouble. We've either got some brain damage, probably brain damage of some sort. Okay? And if there's no reaction whatsoever, it's spinal cord. So that's why we do Babinski. Pulses, all right? Carotid. Where would your carotid pulse be? Okay? So if you go down from your mastoid process and come down to right about here, can everybody feel that? Sometimes you got to look around a little bit, but you're good. All right, don't occlude it, like don't cut it off. Eventually you'll get a little lightheaded. Okay. All right, brachial, 2 fingers on the inside. Brachial pulse. You can either do it from underneath, I prefer underneath, or you can go from here. And you should be able to find it. There it is. You feel it? Yeah? Okay. So that's your brachial, and then you guys know radial, of course, right? So you have to find all 3 pulses. Carotid, brachial, and radial. Okay? Questions so far? That's good. We're almost done. Kind of, sort of. Okay. Let's see. I'm going to borrow this chair. And it,